As many of you who have been on the previous two seminars know, quality is really a very important part of an agency, and at times, because of the day-to-day necessities of running an agency, sometimes it gets pushed into the back. Based upon that, Quality in Real Time employs a cadre of credentialed experts in the quality field that can really assist any agency in meeting their quality assurance performance improvement goals. Based upon what we found in our quality assurance audits and/or our OASIS review and/or coding, I realized that education was key for staff. Based upon that and the knowledge of having done some education in home care, realized that assimilating the knowledge is very difficult for staff nurses, and also that we found educational gains may not be maintained by staff clinicians. Therefore, late last year, I determined that we really needed to create a new department within Quality in Real Time that addressed this need. And we implemented ELITE. Now, ELITE isn't an acronym because, as we all know in healthcare, we love acronyms. And it stands for E-Learning Interactive Targeted Education. And basically what we do is we do focused modular education in the cloud, which means on the computer and with the internet connection so that it can be available to anybody at any time 24/7. And basically these are short modules, anywhere from 25 to 45 minutes in length, so they keep the attention of the clinician who's reviewing this. Based upon the need to have a specific type of person running this particular department within Quality in Real Time, we have been very fortunate in having Maureen Lyman join our staff as our Director of Education. Maureen is a registered nurse who's been in home care for 20 years, has had many, many different kinds of roles. She has been a staff field nurse, an IT educator, so informatics when it was younger, staff development educator, clinical operations manager. She's been an OASIS coordinator within an organization, and we've been very lucky that she has joined our staff. She has really developed ELITE for us, and people have expressed great interest in this program. So now I'd like to introduce you to Maureen, who's going to take you through the rest of this webinar. Maureen?
Thank you, Laura. Good morning, everyone. As Laura stated, this new product is geared towards these modular, short modular OASIS education pieces. And what we have done is we've created a product that is developed for both our customers and non-customers. For our customers, in the previous webinars, Laura mentioned the OASIS summary reports that can be pulled up from the auditing information that is done by the auditors at Quality in Real Time. So we can look at these summary reports, and they will definitely indicate where a nurse or a team or the agency has education needs. Remediation can occur rapidly, and then we can see with both the pre and post test where this improvement has or has not occurred with the clinicians or with the team or the agency. And then we can also use the OASIS summary reports to provide the data to see if there is improvement with these modules. Also, with our non-customers, we feel that ELITE will definitely identify the auditing needs of the agency. It can pull out where the clinicians have some struggle or some deficiencies within their OASIS review process or their assessment process. Again, the benefits to both our customers and our non-customers at Quality in Real Time are consistent educational solutions. I know from my experience that different educators may present information differently, may focus on different areas. With our program, everybody receives the same information in the same manner. And I also know from my experience that I will have clinicians tell me, I was never taught that. Well, I was the one that taught them, so I know what I teach. So this also provides consistency to have these modules are consistent throughout. Also, we can tailor the education needs to either an individual or an agency. So you may have, Nancy nurse may have problems with the functional area, but Jane Doe has problems in the wound care section. So instead of having Nancy learn what Jane is having problems with and Jane learning what Nancy has problems with, we can focus it specifically to the individual. So the modules can be, each staff person can have a different module. Or you may notice that your agency has a specific area of need, and maybe each of your individual staff nurses need to have that functional section because you've noticed as an agency, functional is a problem for you. So we can tailor it individually or by agency. We feel that this is perfect for either, as I said, individual staff orientation or specific remediation. Laura has said many times that this would be perfect for a performance improvement section, program in your agency or quality assurance in your agency. This is ideal for inclusion, again, quality assessment and performance improvement plan. In the OASIS manual, it states that they will be looking for, if you do have deficiencies in any areas, that you do have an improvement plan in place, and this would be perfect to be part of that plan. Another thing is that you can assure that the information is up to date with regulatory and industry requirements. We are constantly, in the listservs and looking in the regs and checking the new regs and really keeping up with the industry. So we looked at this and we said, accurate data is so vital in home care. So we put this little thing together to show the different areas where accurate data may impact or is important. And the first one is accurate reimbursement. We all want to be reimbursed for the needs of our patient and the care that we're providing. So having accurate data is vital in accurate reimbursement. The next section provides proves value to home care to regulators. Laura is a believer in, we have given many flawed data to the repository that we are, if the clinicians are not answering OASIS accurately, we're sending that information to Medicare and maybe not showing exactly what the patients are needing. If a physical therapist goes out to see a patient and they're not comfortable assessing for wounds and a wound is missed, or even a nurse may miss a wound, and then the next person that goes out to see that patient finds the wound, all of a sudden the wound develops on our watch, but maybe the patient came home from the hospital with that wound. So accurate, consistent assessment is so vital to show the regulators and Medicare what the patients are looking like and giving a good picture of what we're seeing so that we can show what our value is. We can also, again, painting that picture of the patient at the time is also part of a regulation. Another area where accurate data is important is to identify the problems and strengths in your agency. It may show you that you're having some struggle with assessing wounds appropriately, or you're having trouble with your wound care and following up with physicians and knowing what the appropriate wound care is and knowing when to reevaluate the patient and discuss with the physician maybe some changes that are needed. So showing your strengths as well as your problems. Then the next area is it assists with accreditation surveys. If your reports are accurate, the first thing that these accrediting agencies are doing is looking at your reports, looking at your outcomes, coming in, saying we want these charts. So we know where they're looking for these charts. They're looking for the problem areas. And are you showing patient improvement? Are you showing that you're using best practices? So with the accurate data, your reports for these surveyors will be more accurate. This is required by CMS. There is the 484.20 standard for accuracy for encoded OASIS data states that OASIS data must be accurately and completely completed. And all questions must be answered appropriately and accurately and completed. The next area that we would look at is assist with development of proper plan of care. I don't know why this is a problem, but when we go out and talk to agencies, the nurses seem to have, and all clinicians seem to have a disjointed thought. They go out, this is the assessment, this is the OASIS, this is the 45, but they don't look at it as a complete picture, that each area helps with the other area. And they really should be looking at the OASIS to form their plan of care. So when they're accurately looking at the assessment, looking at what the OASIS is, what it's for, where it came from, and what the reasons are, then maybe they can see that this is all part of the puzzle. All these pieces of the puzzle fit together. The next area is, again, assuring accurate outcomes. If you have a clinician who may not be as good with the OASIS or understanding of the OASIS and how to answer it appropriately at start of care, and then again, like I said, someone else goes out that may be better at the OASIS assessment, you may show that the patient declined and actually the patient either stayed the same or actually improved, or vice versa. You may have someone that shows the patient so bad and then they got so much better, but they actually aren't. So accurate data, knowing how to accurately assess the patient and how to accurately answer OASIS is critical. And then accurate agency financial reports. We see all the time people putting in, you know, you have a low functioning, low clinical numbers, but yet the patient's having 25 therapy visits at start of care. So you're projecting for X amount of money, and then when it comes down the line, the patient's discharged earlier, they didn't need those therapy visits, and your final bill is not as much as what you projected. So having an accurate OASIS is definitely critical in looking at your financial reports and knowing and feeling comfortable that your financial reports are accurate. So accurate data, accurate OASIS equals accurate data. The other thing that I wanted to mention here was that part of the Office of Inspector General Focus Work Plan for 2012 was to review OASIS data submitted by Medicare certified agencies, including CMS's process for ensuring that home health agencies submit accurate and complete data. So it's very important that we look at the accuracy and also perform audits to determine the accuracy and if the documentation supports that. Okay, a part of the, part of the OASIS manual states that staff development and training must be focused for data accuracy not only at startup of OASIS data collection, but on an ongoing basis. A lot of agencies feel that if there's no change, you know, why do we have to keep going over it? And frankly, a lot of clinicians feel, why do I have to keep coming to this? But it's very important that continuing education occur with your staff to keep them up to date. I've been in this field for so long, and I see clinicians all the time who've been in it for 20 years doing OASIS, and they're still not getting it right. So it's very important to have ongoing education. So when we look at our ELITE, we obviously online format, it's flexible. They can complete this training at any time once they're registered for a module, anytime when they have internet access, laptop, their desktop. We found, you know, I know that this is very important. There's no need for staff to come into the office. They don't have to come in. Their productivity can maybe not be as impacted because many of our staff is far away from the office, and it takes quite a bit to come in and then go back out to their areas. So we felt that this was a great opportunity to do this at the agency. It's more convenient for the agency, but also the clinician. And again, it won't affect their productivity as much. It's interactive. We've created this product using interactive audio and visual instruction. We have the scenarios where we put a scenario out and the clinicians can interact and answer questions throughout the scenario. We have a pre and post test with minimum passing scores. Clinicians would have 2 opportunities to complete the test and pass, you know, get a passing score. At the conclusion, when they have passed the test, they can print a completion certification, which is nice. They can print that out at any time. They can actually go back in and print it if they haven't printed it at the time of the completion. And we have reports that would be available for personnel records. One of the good things with this also is that you can use this for, you know, part of a personnel, part of remediation, if you're having difficulty with a clinician, to show that you've given them education and whether or not they've passed could impact their employment. Also, a good opportunity may be for new staff to provide education and to determine whether or not this could be part of the determining whether or not they would be past their orientation period. We decided that targeted was the best approach. We didn't want to have an 8-hour course that everybody had to complete every section. You can determine what the needs are and by an individual. So if one individual, again, needs functional and another individual needs the wound section, it's targeted exactly what the needs are of the clinician. I can't tell you how many people have said, I'll go through this. Why do I have to sit here? I'm good at this. Why do I have to, listen to what everybody else is having trouble? Why is it my fault that other people can't answer this? So this way, it's modular, targeted, exactly what the needs are of your agency or the individual. And again, you don't want to, time is valuable. The more time that is spent in education that may not be necessary, the less time that's spent on patients. Personalized, Elite will work with you to develop a training plan designed for your individual or members of your staff. So whether, again, you need that functional for Jane Doe or all of your staff need functional, we would set up the individual modules for each of your staff member to take it individually. So right at this point, we now have, these are the basic modules that we have. We've split the OASIS module into, OASIS program into 9 modules. We have the basics, which deals with OASIS background, purpose, and impact. And it looks at the OASIS regulations, the different types of OASIS and when they would be completed, and the OASIS completion conventions, the rules on how to answer OASIS questions. And then we have patient tracking, clinical items, history and diagnoses. We have integumentary as its own little module because we all know that that's a difficult module or section. Respiratory, cardiac, elimination, neuro, and sensory. Functional living and therapy needs. Then we have our medication items are separate, a plan of care, intervention synopsis, and emergent care and discharge items. Then we are in the process of developing OASIS assessment in the home where we actually can help the clinician. You walk in the home and you ask the patient to go get their medications, what OASIS items can you assess just by that one task? And then have the patient take you to their room and what can you evaluate while they're going to their room, while they're showing you their bathroom, while they're showing you where they sleep. And then while you ask them to remove their clothing so you can assess for wounds, what other things can you say? Can they undress themselves? Can they dress themselves? So it's just basically how can you look at your OASIS as part of your assessment and not say, okay, now I have to ask you these questions. So it needs to be part of this, your assessment in the home. And then we have a module for documentation for accurate coding. How can the clinician document in the chart to assist the coder, the certified coder, to select the accurate coding? Because the clinician in the home selects the diagnoses, but the coder is actually the person who would assign the correct code. And we have many more modules in the works and in the plans. Laura would like to move into other areas of community health, home health aid, education, so we have a lot of plans for the future for more modules. We're going to be also looking at best practices for nursing and therapy. So I'd like to show you a quick little demonstration of it's our demo module. It is just a quick little glimpse at it's a short little version of one of our modules, and I don't have audio. I apologize for that. It doesn't work within the GoToWebinar. So the clinicians would get a unique sign-on and a password that would be changed. They would change it as soon as they get in that first time. Okay, so this would be what the learner would see when they came in. These would be the modules that are assigned to this particular learner. And they would only have access to the modules that they have been registered for through whoever deals with it at your agency and through Elite. So we're going to take a look at this. They would just simply hit click. You'll see here, this tells me there's a presentation with a quiz. We can do just testing. We've talked about possibly doing just OASIS test to just test the person to see what areas they may need some education in if you're not able to identify that. And then it also says that it's not started. There's a history. You'll see here this module was completed, so there's a certificate link. That's where I would get the certificate, but I'll show you that when we finish the demo. So basically they would launch it. It opens up into a separate screen, a little pop-up screen, and it goes right to the module. Now again, they have audio, so they would have audio, you would hear audio overhead. And you'll see here that there's controls. I've made all of the modules at this point are user controlled so that they can work at their own pace. So each module tells you who it's targeted for. Our basic module, I felt that we could also have our administrative staff, our schedulers, people that may be assigning OASIS, that just to give them a kind of an idea of what OASIS is, why it's done, when it's completed, so that they would understand a little bit more about these visits that they might be scheduling the clinicians for. And then they would just move along. This tells the user what their completion requirements are for this module. And then I just wanted to show you a few of the different types of screens that you would see. There's a to-do list. It tells them what they're going to learn in the module. And again, this is just a brief version of the basics module. I try to bring in regulations and point the users to where they can get more information on this information. You know, it's not made up. These are the requirements. Here are the regs. This one, what is it used for? And again, each of these screens has audio going more in depth into each of the items. Just wanted to show you some different types of screens. And then again, there's a pre-test that I didn't have in this demo, but then there's a post-test for each one as well. So let me just show you. This is just a sample. There's just 5 different types of questions. I just wanted to show everybody the different types of questions that we have here. I did adjust our test so that they will get partial credit for that. So let me just show you a different certificate in the interest of time. So the learner, when they complete, can come in and pull up the certificate. And they can actually pull the certificate up at any time, but it'll be ready as soon as they're finished. And it just shows their name, the module they completed, and the date they completed. And they can print this out. They can send it to their manager. They can send it to HR. You know, again, we have reports that can go to HR or the managers, but the clinician can do that as well, or they can print it out for their own use. So we think that the benefits of LEAD are competitive pricing. We have, I think Laura maybe can speak to that when we're finished at the end, but we feel that we have competitive pricing when we look at other pricing out there. And also, again, the fact that you're not bringing people in for an 8-hour class, all your staff, you're not having a instructor for a whole day or multiple days. I know I worked in a very large organization, so when we did a presentation, it was weeks worth of presentations. And also the fact that you can target it for the specific area that a person may need. We feel that it can improve your quality outcomes. Again, accuracy is the key. If you have accurate data going in, you have good stuff coming out. So quality outcomes, it's one piece, obviously, you have to provide quality care, but if you have the accurate data going in and at the end, then you will show quality outcomes. And then the peace of mind that your training is consistent, that it's targeted for specific needs, and that quality in real time, you know, is maintaining the regulations and industry up-to-date information and requirements. And then collaboration and expert opinion. As Laura stated, quality in real time has an enormous amount of quality people who are duly certified, who, you know, are experts in outcomes, OASIS, coding, auditing. So you can feel comfortable. We also welcome collaboration. That is one of the best things about quality in real time. They welcome input and they work with their clients to really come up with the best way to manage through home care. And we welcome any ideas. We are going to be asking our clients, what do you want? What education do you feel you need? What can we do for you? So we feel that you guys know what you need. So we will definitely collaborate with you. Okay, so that's the end of our presentation.
Okay, great. Thank you, Laura and Maureen. I thought that was very helpful information. I think we have a little time to take a couple questions. So let me, if everybody's forgotten how to put the questions in there on the right-hand side of the control panel, there's a question area. Go ahead, just type in your question there, and I'll go ahead and read that off. We do have a couple that are queued up here. Here's one, Maureen or Laura, whoever wants to take it. Is OASIS education required by CMS?
You want me to take that, Laura?
Yeah, go ahead, Maureen.
Okay. OASIS is not, education is not required by CMS. However, as I said in the presentation, accurate answering of the OASIS. The OASIS is required by regulation to be accurate. So to maintain accuracy, it is recommended by OASIS, by the OASIS manual and by CMS that ongoing education occur. Even if there's no changes in the OASIS, education needs to be ongoing.
Okay, great. Thank you.
And I would chip in with, I don't know of any agency that I've ever seen that does not do OASIS education, either on orientation or ongoing during the year.
Yeah, there was, I think at one time, a recommendation that after the initial education, that 4 hours a year, I think.
Mm-hmm.
But I think that was a recommendation. You know, CMS is not going to tell you have to.
Sure. Mm-hmm.
But it is recommended.
Mm-hmm.
Okay. Here's one. Cuts right to it. Is how much does ELITE cost?
Well, that's a good question, and I will answer that. We debated for a very long time on this question because we wanted to make it affordable to agencies. We wanted to make it appropriate for agencies, and we did do a cost analysis across the country of other organizations who may be doing this. There are not many, but what we did come up with is in the modular form. We bundled together the 9 modules of the OASIS for a cost of $485 for the 9 modules for one person. And we did this because we did have some interest and some buyers who are very small startup agencies and determined that while they would orient their new personnel to OASIS, that they felt that after the initial orientation it would be better for the clinician to have the availability of all of the modules of the OASIS piece separated out, and so they could focus their education ongoing, some of them with mentors in the field or preceptors. They could focus the education and take the modular test as they went along, or that they had some areas that their preceptor identified as needing assistance. The additional individual modules are priced at $65 per module per person, but we do give discounts to court customers, and we do give volume discounts so that if you buy a certain amount of individualized modules, there would be a discount on that price. We are very willing to talk with people about their needs and to develop a plan that assists them to purchase the correct amount of modules if they feel they need them, or the correct amount of the bundled packages for the OASIS review.
Okay, great. I've got another question here. Can your education be tailored to specific items in OASIS? For example, improving case weight scores at final claim, which MOO items impact, hold on, I can't read it all here. MOO items impact or home health compare scores, how to appropriately score a wound, etc.
Actually, the integumentary module does work with that. I still am amazed that staff, we find that clinicians have difficulty staging wounds and assessing the type of wound. So our integumentary module does approach that, and the scenarios target that particular area. As for improving the case mix index, I am of the opinion, and it's just my opinion, that it is not fair to expect clinicians to code. I think that it is fair to expect is that they document appropriately so that a certified coder can code appropriately and therefore increase the CMI appropriately for the agency, so the agency is reimbursed correctly for that acuity of that patient and the plan of care that they plan to deliver to the patient. So yes, I think we can increase the CMI, but I think it occurs through the documentation of the clinician, and we do have the module of documenting for coding accuracy built in. So I would agree with that. As for home care compare scores, we are very, one of the modules there is discharge items. Having been, a consultant and having looked at either adverse event reports for years or potentially avoidable events, I found that fully over 50% of some of the events were because the clinician incorrectly answered a question on the discharge OASIS. However, we don't go back to CMS and go, oops, Mary Nurse did not answer the UTI question correctly. We let that go, and so it does go into the database, again, as flawed data. So these are some things that we attempted to do in our modules. We took these pieces. So I believe that with this education, there can be remediation in answering the discharge items correctly and therefore impacting your home care compare scores. Another point on home care compare is that a lot of the questions are, did the patient get better at, ambulation or toileting or whatever the questions are. The issue we find with that is that at the start of care, the clinician did not answer the OASIS correctly and made the patient perhaps almost functionally independent, because clinicians traditionally, we have found, do not score safe ability of the patient, but score the ability of the patient, which are two very different things. So therefore, they make the patient fairly well, and there's no room for improvement to happen. So at best, the patient remains stable, and that is actually not true. It's not accurate, because the patient may have been a 3 and marked a 1, and then at the end you mark it a 1, but the patient was a 1 coming in. So it doesn't show the acuity of the patient. So I believe the modules would address that particular part also for the home care compare, and it would improve it.
Well, it looks like it's it for all the questions, and actually that's it for all the time we have today. I do want to thank Laura and Maureen for joining us today and giving us a great insight into community health education. I think it's incredible. I also want to thank all of our users who have joined us online today. It's my hope that you found today's topic informative and actionable. Everyone should have received an email with this presentation for download prior to today's webinar. This will be posted on the GLMI YouTube channel for later viewing. And if you did not receive that email, one will be sent out following this presentation with the presentation to download, as well as the link to the YouTube channel. So if you didn't receive that, just kind of look out for that via your email. If you don't receive one, just give me a call and let me know. Also, keep an eye out for the next expert webinar series beginning in July. So I want to thank Laura and Maureen one more time, and everybody else who joined us, and I want to wish everybody a wonderful day.
Well, thank you, Art, very much. We appreciate the opportunity to present, and have a wonderful summer, actually.
Great. Thanks, guys.
Thank you. Bye now.